Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Herpes simplex virus, we are looking at its clinical manifestations. So the first one will be the cutaneous lesions. So what are the cutaneous lesions? So cutaneous lesions, there is presence of the fever blister. So there will be the fever blister. Next is the herpetic whitlow. So there is herpetic whitlow. Then herpetic gladiatorum. Next is the eczema. The eczema herpeticum. Eczema herpeticum. Then comes the eczema. Here the eczema herpeticum. This is a generalized eruption caused by the herpes infection. So it is a generalized eruption. So generalized eruption caused by the herpes infection, and it is present in the child. It is present in child suffering from the eczema. Next is the mucosa. So when you look at the mucosa, it is the most common site involved in the buccal mucosa. It is the most common site involved is a buccal mucosa, and it may cause the gingivostomatitis. So it can lead to the gingivostomatitis and also the pharyngitis and recurrent herpes labialis. Then we move on to the ophthalmic. So here in ophthalmic, it involves the follicular conjunctivitis and also the acute keratoconjunctivitis may occur. So there is acute keratoconjunctivitis, it may occur. Then we look at the nervous system. So here in nervous system, there is a HSV encephalitis. There is HSV encephalitis as well as the HSV meningitis. To learn and grow daily like this, please do subscribe.